right, thank you. So I have no disclosures other than this is my favorite topic, so sometimes I get excited and talk too fast. So I'll try to slow down and try to keep this under 20 minutes. So my ambitious goal today is to talk about some trends and instances that we're seeing in gastric cancer. Also discuss a little bit about the molecular subtypes and how that may affect how we treat gastric cancer. Then I want to talk a little bit about staging, perioperative therapy, surgery, and then the management of peritoneal metastasis. So we'll see if we can get all this done. So as many of you know, the incidence of gastric cancer in the U.S. is declining, and it currently is the 15th most common cancer, with about just under 30,000 patients diagnosed every year and about 11,000 deaths. However, the cancer-specific mortality ranks around 8th in the U.S., and so it is still a major health issue. Fortunately, the incidence is declining, and the mortality rate is declining as well, and that's basically parallels the improved survival now with multimodality therapy. We've seen some interesting changes in histology over the last several decades. The intestinal histotype is decreasing, and the diffuse histotype is increasing. This also correlates with changes in location over time. So the red arrow is the distal gastric cancers are decreasing over time. The green, the proximal gastric cancers, are increasing over time. And this likely is related to changes in risk factors. So as we've been doing H. pylori eradication, we've had public health initiatives for smoking cessation, we've had improvements in food preparation, we see a decrease in the distal gastric cancers. And then as we have an increase in obesity and gastroesophageal reflux, we're seeing more GE junction and cardia tumors. An alarming trend that we've been seeing is the change in age over time. So gastric cancer has been declining in every subgroup except for the early onset gastric cancer. That is, we've actually seen an exponential increase starting in the 1990s, and now it comprises over 30% of all gastric cancers are actually on what we would define as early onset gastric cancer. And as I mentioned, this is a major public health concern, and in fact, they estimate about 15% of all stomach cancers in the U.S. could be prevented with simple weight loss reduction, alcohol consumption limitation, and avoiding processed meats. So let's move to molecular subtypes. So the Cancer Genome Atlas a few years ago analyzed 295 tumors worldwide and did whole DNA sequencing, RNA sequencing, and protein arrays. And they identified 4 genetically distinct subtypes of gastric cancer. Most commonly are the chromosomal instability, with 50% there, kind of defined by the intestinal histology and the p53 mutations. Then you have the genomically stable, which comprise about 20%. These you typically see with CDH1 and Rho A mutations. And then 9% are Epstein-Barr virus related.